Chapter 44 Anti-Hyperlipidemics and Drugs to Improve Peripheral Blood Flow. Lipoproteins, fats. There's the high-density lipoproteins, HDL. This is the good fat. It helps to remove cholesterol from your blood and transports cholesterol to the liver for elimination. There's also the low-density lipoproteins, or LDL. This is the bad. It contains the higher percentage of cholesterol. Apolipoproteins. These are located within the lipoprotein shell and are a major component of both HDL as well as LTL. To deal with high cholesterol, we have anti-hyperlipidemics. And there's going to be many different types. There's the bile acid sequestrants, the fibrates or fibric acid, nicotinic acid, or cholesterol absorption inhibitors. And finally, one everybody's familiar with, statins. Bile acid sequestrants. These reduce LDL cholesterol levels by binding with bile acids within the intestine, and they're effective for hyperlipidemia type 2. Side effects would include things like anorexia, nausea, vomiting, cramping, constipation, flatulence, steatorrhea or fat in the stool, GI bleeding, peptic ulcers, and a folate deficiency. Fibrates. These reduce triglycerides as well as VLDL and are effective for hyperlipidemia type 4 and also type 2. Though keep in mind they are also contraindicated with anticoagulants as it may potentiate bleeding. Side effects would include dizziness, headache, nausea, vomiting, diarrhea, and elevated hepatic enzymes. Niacin or nicotinic acid. This works to reduce both LDL as well as VLDL. Side effects would be dizziness, headache, hypotension, edema, flushing where the skin would get beet red will occur in some patients, liver damage, hyperglycemia, and hyperuricemia. Cholesterol absorption inhibitors. These act on the cells in the small intestine to inhibit dietary cholesterol absorption. Must be combined with a statin for optimum effect, and side effects would include things like fatigue, myalgia, and arthralgia, as well as diarrhea, abdominal pain, again cholelithiasis, and elevated hepatic enzymes. Statins. These inhibit the enzyme that's responsible for cholesterol biosynthesis, working to both decrease the LDL while increasing the HDL. Side effects would include things like headache, fatigue, GI distress, abdominal pain, cataracts, hyperglycemia, rhabdomyolysis, which is important. This is one that you're going to see come up a lot in ATI and NCLEX, and that patients on a statin are taught to report muscle pain, as that's an indication that rhabdomyolysis is occurring and the muscle is being broken down. Another common question for statins is going to be that they should always take it at night before bed, as when you're sleeping is when a lot of cholesterol is processed by the body. For our laboratory tests, we're going to be looking at things like homocysteine, where high levels are linked to cardiovascular disease, stroke, and Alzheimer's disease. It may also promote blood clotting and can damage the inner lining of blood vessels. There's also going to be three vitamins that lower serum homocysteine levels. That's vitamin B6, vitamin B12, and folic acid. High sensitivity C reactive protein. This works to detect the inflammatory process due to atherosclerotic plaque buildup, especially within the coronary arteries. Non-pharmacologic methods for cholesterol reduction. Reducing saturated fats and cholesterol within the diet. Reducing total fat intake to 30% or less. And reducing cholesterol intake to 300 milligrams a day or less. This would be in addition to exercise and stopping smoking. When looking at drugs to improve peripheral blood flow, again, we're looking at things like statins, as well as some antihypertensives that work in vasodilation, like ACE inhibitors, calcium channel blockers, and antiplatelet medications like clopidogrel or aspirin. Peripheral vascular disease. There's arteriosclerosis, hyperlipidemia, and atherosclerosis. Signs and symptoms would include things like numbness and coolness in the extremities, claudication, and leg ulcers. When you hear the term claudication, think of it like angina of the heart, but in this case it's the leg muscles. Is when the patient is walking, they'll begin to get sharp pain in their legs as the blood flow is not able to provide oxygen to those muscles. And that's a subject we're going to talk much deeper about in MedSurg next term. Antiplatelets, cilostazol, causes peripheral vasodilation while also inhibiting platelet aggregation. It's used for things like intermittent claudication and would have side effects like dizziness, headache, peripheral edema, GI distress, abnormal stools, tachycardia, dysrhythmias, and orthostatic hypotension. Hemorrhagics like pentoxifylline. These decrease blood viscosity while inhibiting platelet aggregation. They also improve the flexibility of erythrocytes and improve the microcirculation and tissue perfusion. Side effects would include nausea, vomiting, confusion, and could also lead to blurred vision, hypotension, and tachycardia. When giving any antihyperlipidemics, we want to carefully assess vital signs, get a baseline for both vital signs as well as their lab values, and a thorough medical history. We also want to keep a careful eye out for any development of ischemia. We want to carefully monitor the patient's blood lipid levels, monitor any lab values for liver function, as statins and many of these others are hepatotoxic. Observe for signs and symptoms of GI upset, and instruct the patient to have annual eye exams and report changes in visual acuity. Cilostazol. Get those baseline vitals for future comparison, and keep a careful eye out for inadequate blood flow to the extremities. Ischemia and hypotension are going to be major dangers with this drug. We're also going to want to keep a careful eye on both blood pressure and heart rate, and inform the patient that a desired therapeutic response may take 1.5 to 3 months. They should also abstain from both smoking and alcohol, and encourage the patient to change physicians slowly due to the risk of orthostatic hypotension. For our first practice question, a patient's serum lipids are cholesterol 197, LDL 110, and HDL 35. What should the nurse conclude about these values? That be A, that serum lipids are within desired values. B, cholesterol is within desired value, but LDL and HDL are not. C, cholesterol is not within desired value, though LDL and HDL are. Or D, cholesterol, LDL, and HDL are not within the desired values. And that answer is going to be B. Cholesterol is within the desirable value, but LDL and HDL are not. Remember, we want our cholesterol and LDL low, but we want our HDL to be high, above 50. Question 2. A nurse who is administering atorvastatin realizes the importance of monitoring for which serious adverse reaction. That be A, pharyngitis, B, rash imperatus, C, rhabdomyolysis, or D, a granulocytosis. And that answer is going to be C, rhabdomyolysis. Again, this is that muscle breakdown. And then the waste from that muscle breakdown can actually clog up and damage the kidneys as well. The patient is scheduled to receive gemfibrozil. It is most important for the nurse to assess for concurrent use for which medication. That be A, acetaminophen, B, ibuprofen, C, warfarin, or D, folic acid. And that answer is going to be C, warfarin. Question 4. The patient is receiving medication therapy for peripheral vascular disease. Which medication does the nurse identify as an antiplatelet drug? That be A, cilostazol, B, papaverin, C, prazosin, or D, nifedipine. And that answer is going to be A, cilostazol. And for our final question, which herb is most often associated with the treatment of intermittent claudication? That be A, ginseng, B, valerian root, C, St. John's wort, or D, ginkgo biloba. And that answer is going to be D, ginkgo biloba. And especially when it comes to ATI and NCLEX, when you see that coming up in peripheral vascular or especially anticoagulants, never combine ginkgo biloba with another anticoagulant. But anyway, that's all we got for this chapter. I'll see you in the next slides.